we are talking about Medicare Advantage in terms of where these cuts come from, not Medicare benefits through the traditional Medicare plan. The problem, I don't think, is that we gave seniors prescription drug benefits. I think the problem is that we didn't pay for it. And what we also know is, and I just want to point this out, Tom, 180 billion of it's going to insurance companies. It's not going to seniors. It's going to insurance companies, including big insurance company profits, so, without any appreciable improvement in health care benefits. That's not a good way for us to spend money. I agree with you about the fact that the prescription drug plan added to our deficits because we didn't pay for it. And I just have to point out that didn't happen under my watch. It happened under the previous Congress. There's some people, you know, John is an example of somebody who was true to his convictions and didn't vote for it.
I didn't vote for it.
But the fact of the matter is that, you know, that was costly, and we do have to deal with that.
Mr. President, we'll now turn to Chuck.
First of all, to clarify something, if anybody says that Medicare Advantage is a subsidy going to insurance companies, let me say what the statute says. The statute says that 75, with a bid differential where it goes, 75% goes to beneficiaries and benefits and 25% to the federal government.
I'm sorry, Chuck, I just want to make sure that I don't think that doesn't sound right to me, because that would mean 100% of it is going to either benefits or the federal government, which means the insurance companies aren't making any money.
75% to beneficiaries and benefits and 25% to the federal government. There are these things in this bill, Medicare, Medicaid cuts, that I don't see any future Congress having any more guts than we do to close a rural hospital. So I think that you got to take into consideration, you've got to take into consideration the consequences of the acts or the unproven promises of cuts that aren't going to materialize. That's just the way I see it. And working in those 31 meetings, hundreds of hours of meetings with Senator Baucus, I learned a lot about health care. Now, we didn't get a bill out of that bipartisan effort, but I'm sure glad I spent all that time there, because I learned a heck of a lot about our health care system that I wouldn't have otherwise known. But do you think that we're going to sit around in rural America, or even in urban, downtown urban America, in the poverty parts of the city, that we're going to let hospitals close down?
Thank you, Chuck. I'm going to go to Kent next. I just want to make one point. If the notion is that we can't make some hard decisions about how entitlements work because it's just not realistic, nobody's going to have the guts to do it, then we're in big trouble, because that means that the federal budget and state budgets and then business budgets and family budgets are all going to be gobbled up by this thing. So I hope that, in fact, we've got the courage to make some of these changes. Now, you know, when I say that Medicare Advantage is not a useful way for us to spend tax dollars to provide health care to seniors, at least the way it's currently structured, as I said, that's not a Democratic idea. I mean, there are a whole bunch of Republican commentators and some of the folks who've sat around this table before who suggested that that's probably right. You can make an argument that whatever savings we get out of Medicare Advantage should not go to filling the donut hole, for example. That's a legitimate argument. You can make an argument that it should go just to deficit reduction. You know, those are all legitimate arguments, but my point is that the savings that are obtained here are from a program in which insurance companies are making a lot of money, but seniors who are in these kinds of programs are not better off. And the 80% of the people who are in these programs are paying an extra $90 a year to subsidize the folks who are in them. And that just doesn't seem like a good deal for them or for the